During COVID, we have been involved in raising funds for the charity. We have had funding coming in via donations from Just Giving website and also from grants from NHS Charities Together. And I'm delighted to say that through those sources we have raised over £150,000. Some of that money has already been utilised in providing wellbeing items to patients and service users and to staff throughout the Trust. I cannot end this without saying a tremendous thank you for all the support that we have received, not only during COVID but during the current year, and look forward to your future support in years to come.
During this time of COVID-19, we have recruited something like 83 new volunteers from around Hampshire. And our volunteers have mainly been working in the delivery of personal protection equipment, PPE. They've also been delivering goods, making face masks, working in IT, doing a variety of jobs. And we've also benefited immensely from companies around Hampshire who have helped us with removals of equipment, heavy equipment, delivery of goods again. So we've been working with removal companies, housing associations, and staff who've been furloughed from a tiling company. So we've altogether used well over 100 people, good people, lovely people from Hampshire who've helped us during this time. One thing that we have enjoyed as well is the work of so many people in Hampshire who work for various little organisations and associations around the county, who have been phoning people in their isolation, shopping, keeping in touch, driving people to appointments. We've been immensely grateful for the help of so many people. Finally, I'd just like to say a great thank you to a wonderful team who have helped us recruit so many people, and the wonderful generosity of so many around Hampshire has been so encouraging and so immensely beneficial to those whom we serve and support.
Hi, I'm Robert Cragg. I'm Deputy Director of Inclusion and Organisational Development here at Southern Health. Just delighted to tell you about some of the brilliant impact that the workforce team had during the COVID pandemic. So first off, I'd just like to thank our training team in Leeds. So they delivered 3,000 face-to-face trainings of essential skills and competencies during the lockdown period, as well as helping sustain 12,000 learning contacts online. They also supported 146 students to work in our clinical environments during this period, which was a really big undertaking. We also were able to provide all of our e-learning materials out into hospices and wider health and social care providers, helping them learn and stay safe. We also received some brilliant help from further afields in the form of bowling alleys in Alton and Lymington that enabled us to train staff in a socially distanced manner that some of our premises don't permit, so thank you to them. And we also brought in people with one-stop inductions so that they gained all the clinical competencies they need before they went to the front line, rather than having to learn them on the job, which is usually the instance. Our people development team were also really well utilised during this period, so they set up a listening service for our staff called Listening Ear. That took 100 calls dealing with things from social isolation, loneliness, all the way through to anxiety about the predicaments that they were facing in the working environment. We also set up a health and wellbeing hub which has been accessed by 3,000 individual staff during that period, which has helped them sustain their resilience and seek support and be signposted to essential psychological advantage support. We also set up risk assessments for staff, both on an individual level and also at premises, making sure that people felt individually safe and that our premises were safe for both patients, staff and the public. A huge undertaking was also taken by our HR team, who did a huge piece of work around bringing people in essentially in that time, and they brought in 229 people, and it took the people an average day from recruitment to starting was only 11 days, which is a really big undertaking with all the checks and balances that had to go into place. HR did a brilliant role in supporting all of our shielded staff who were unable to come into work during that period. They helped out redeploy people from department to department to make sure that our skills were best utilised during the pandemic, and they were also pivotal in leading our Gold Command. So a massive thanks to all our Workforce Directorate colleagues.
During the COVID crisis, communications has been a hugely important part of how we support our staff and our patients and the public to understand what's happening, what's going on, lots of changes in the way that we're working. New guidance being released all the time, and it's been really hard for everyone to keep on top of that. So as a communications team, right from the start, we really changed the way we worked completely. We went to sort of 7-day working. We put out daily updates to staff about what was happening. We did a huge amount to inform the public and make sure that the really important messages about stay at home were being communicated. We worked with the media to get really good stories out about how to look after yourself during lockdown, how to look after your mental health, and the fact that our services are still around. So a huge amount of work there. But really, we prioritised our staff and how we were communicating with them. We developed new technologies. We used things like Facebook, social media, videos, and lots of other methods to keep our staff informed and aware about what was happening. As well as what was happening, also how we could all look after our well-being, recognising how challenging it's been. So I just really wanted to say a huge thank you to the communications team for everything that they've done and are continuing to do. And also to all of our staff, really. It's been the most incredibly challenging time, and you've all done an incredible job. And I'm humbled to be part of a team that supports you guys doing what you're doing. So thank you very much.
What has technology been up to and IT? Well, we've enabled most of the staff to work remotely, brought in a whole new series of initiatives to enable digital working, new mobile devices, working from home and that kind of thing. We've also increased the accessibility of our IT support services by online initiatives, creating phone call handling systems so the staff can work from home remotely in line with the government guidelines. We've also had an explosion of uptake of digital technologies, and this has created digital leads and a digital champions network out throughout Southern Health, which basically has allowed us to create an information flow and understand what the demand is from our user base. In terms of patient-facing initiatives that we've conducted, video appointments have absolutely exploded. We went from about 20 appointments a week back in March to over 1,500 appointments a week at the moment. And they're great. They allow patients ease of access to our service. They reduce our carbon footprint in terms of decreasing travel costs, and they allow clinical contact with our patients in line again with government guidelines. We also introduced a new Rio mobile system. So Rio is our electronic patient record system, and this new system allows a tablet device to allow on-the-fly record keeping to be undertaken really easily in patients' homes, and it's actually improved the amount of, or decreased the amount of time taken for record keeping, which has allowed our clinicians greater time to care, and we're now looking at rolling that out on a much larger system. So I'd like to say a huge thank you, not just to my team who've worked incredibly hard in technology over the last 4 or 5 months, but to the entire shift staff. Getting through Corona pandemic would not have been possible without the contributions of all of our staff helping us through these difficult times.
Within Estate, we are responsible for maintenance, capital programming, domestic services, transformation and catering. I just wanted to take this opportunity to say how much I really appreciated all the support from my team, and a big huge thank you to all of them for working so hard during the COVID pandemic period. We developed plans in the early stages to increase bed capacity by 670 beds. We also reshaped some of the estate and laid 852 metres squared of new flooring, and we supported the creation of PPE and PPE hubs, and some of our people actually became PPE drivers, delivering PPE supplies to the frontline staff. We also increased our cleaning hours and arranged temporary storage. Finally, my amazing team managed to source 7,000 additional ready meals per week, and from the aviation sector, 32,000 snacks were made available for staff. None of this would have been possible without your support. So a really big thank you from me. Thank you.
I've got a few teams, corporate teams, who have supported during COVID and had their own challenges to deal with. Clearly finance sits with me, and the team have been incredible, led by Kim. They've done everything they could to support staff and patients during this time. We've obviously needed to keep the money rolling, we've needed to pay suppliers on time, we've needed to ease the burden of budget managers, and they've done that so well. They've been first in the queue if something's needed to be delivered. Some of the team were out delivering staff meals, as I recall. So they've done an incredible job, and it's one of the busiest times of the year for our team. The procurement team are also one of mine, and they've been led by Fiona during this time. And she's done an incredible job. The ask for procurement from almost nothing, just normal business as usual, to having to cope with, for example, PPE, or opening up 300 new beds, and all of the supplies that we needed for that, was an incredible journey, I suppose. Over a period of probably a week, we went from almost nothing to realising how much needed to be done. The volume of PPE that's coming into the trust that needs effectively its own supply chain had to be set up from scratch, and I'm really grateful to everybody that stepped in to support from other teams. Our business planning and performance team, and the guys that work with contracts, all led by Sue. In some cases, we're able to redeploy directly into the divisions, and that was really important because we wanted to ensure that as many people were sat within the divisions supporting where they knew they needed help the most. And I'm really grateful to that whole team for everything they did to flex around the business requirement during COVID. So finally, thanks to everyone. Thanks for every little thing you did, whether it was being a safe pair of hands that stayed on finance, or whether it was the person that was redeployed into a team that needed the help more. I'm really grateful for everything you did, and you did an amazing job. Thank you.